So I'm Renard. I'm the head of the Department of Endocrinology, Diabetes and Nutrition at Montpellier University Hospital, and we are part of the consortium Forgetdiabetes that aims at developing a new device for the treatment of type 1 diabetes. Our department is deeply involved in the development of technologies for diabetes, including insulin pumps, including glucose sensors, and the connection between the two that forms an artificial pancreas. Moreover, our department has been involved since now more than 25 years in the development of an implantable device for insulin delivery. And Forgetdiabetes has as main goal to combine these two new technologies. The basis of the project is to come from an implantable device like this implantable pump. It is currently available but used for treatment of a few patients. Our center is a center where most people in the world are treated with implantable devices. This kind of implantable insulin pump is currently implanted for 7 to 8 years in patients. It uses the physiological way of insulin delivery through the peritoneum, but it has some burden because it doesn't measure glucose, so that the patient has to stick their finger or use external sensors to know what should be the delivery of insulin from the implantable pump. These patients have also to come every 6 weeks in our department to refill the pump through the skin using this central port. And so it's of course a very high benefit for glucose control, but it has some burden. So coming from the work we have done with other teams like the team of Claudio Cobelli in Padova, the aim is to combine this kind of implantable pump to an implantable glucose sensors that would measure glucose at all time and forward this information to the implantable pump. In this pump, an algorithm will be set so that insulin delivery will be tuned according to the glucose levels and what is expected about the evolution of glucose level in the forthcoming minutes and hours. Moreover, the goal of Forgetdiabetes is to refill the pump without external puncture of the abdomen, so that the pump would be implanted close to the gut so that it could be refilled from the gut by swallowing some insulin, protected insulin in capsules, so that this capsule could refill the pump without any trauma, and it could be done at home by the patients. Another goal of the project is to make this kind of pump smaller but also very well tolerated by the body, so that there is no risk of adverse reaction against the pump that could result in pain for patients or any other problem. So our goal in the project is to combine these technologies and to implant them in animals, in big animals, so that we can assess what is to be done in the future project for humans, so that we can assess the efficacy, the safety, the tolerability of the system, and what would be the best part of the abdomen to implant this pump. So the first step will be to assess the implantability of a small high-technology glucose sensor. Second step will be to find the best place close to the gut where the pump will be implanted, and to put the algorithm in the pump so that the implantable sensor will speak with the pump and modulate insulin delivery. And hopefully, at the end of this Forgetdiabetes project, a first implantable in humans could be done. So we are very excited in the development of this very innovative technology. It will be a breakthrough, not only for the glucose control of many patients with type 1 diabetes, but also for their quality of life and so that they could really forget diabetes.